I'm here with Tracey DeGraaf, a face that may not be familiar to some, but is well known to me as a great asset to our Crossroads Relief and Development team. Welcome.
Thank you.
You are our Senior Program Officer, so you're the person responsible for the fact that all of our programs are so amazing.
Oh, well, thank you. I'm part of a team that makes it work.
That's the right answer. And today we're talking about a partnership with Save the Mothers, which is fighting maternal mortality in East Africa. And it's new to some of our viewers, but you've been working on it for a while.
Mm-hmm. Yeah, I've been working behind the scenes for about 4 years, 5 years even. The past 3 years, we've been looking at developing the program. So I work with everybody else behind the scenes who's in country to develop the program so that when the program's executed, it goes smoothly and we're ready for it to go.
You're so good at that. I always learn so much talking to you. And you know, this project is so exciting to so many of us. You're a mom. I'm not a mom, but I feel very strongly about mothers. I have a great mom. So saving the lives of mothers, what are we actually doing in East Africa that's going to help make a difference in moms dying in childbirth?
Well, they're dying in childbirth because, you know, the situation is similar to what it was in Europe about 70 years ago. So I'm going to try not to cry. My grandmother died in childbirth, and she died because she didn't get to the hospital. So she bled out. She left my mother 7 years old. And that's exactly the situation in East Africa. They're not getting to the hospital for various reasons. When they get to the hospital, there's not the equipment or the doctors or the knowledge or the skills to be able to save their life in the moments that they need to intervene. So the last 24 hours or during pregnancy, delivery, and then post 24 hours after a child is born is critical to both the child and the mother. Mm-hmm. And it's being able for the medical people to intervene at that moment. Whereas when you're still, you know, in your community and not getting to the hospital, you're not in the place you need to be saved. Then the woman bleed out, or they just don't have the care that they need to live. And
there's that kind of attitude that I notice in Africa, you know, that giving birth is like warfare. Women are warriors. Some people come back alive, some people don't. And there's even, I've heard people say, like, if you're working in the field and you get your labor pains, just lay down, deliver in the field, and then just kind of keep going on with your day, right? Like, it's not treated as a health risk.
Well, there's a cultural element that says that you are a strong woman if you get through childbirth, and that it's just about being a strong woman and your resiliency. They don't understand necessarily the medical sides, it's not about the woman's strength or her courage or anything like that. It's about a medical intervention that's needed, so they don't understand that. So that's the cultural aspect. I think there's another aspect that's just sheer poverty. When you are in poverty, you're surviving. So you are out working right up until your baby's born, and then when the baby's born, you go back to work because you have to eat. And that's what, you know, we don't have that here in Canada, so it's harder to understand. But that's really an element of it. It's hard life.
I know that this cuts really close to home to you because you were there about a year ago, and you really, you know, like, you're a seasoned veteran in the field. 16 years you've been working in development, 10 years for us in Africa. So you've seen a lot, you know, but I know that this last trip really hit close to home. What was it about it that really kind of traumatized you, really?
Yeah, and I was traumatized because, you know, I've seen a lot. We've worked in HIV/AIDS. We've been where people don't have medical treatment at all, so there's no hope for changing life in a lot of areas. But I've come through all that. This situation, I went to the highest referral hospital in the area that I was in. So that means that when you go to the walk-in clinic here in Burlington, and they refer you to Joseph Brant for the specialists, for the area that you need to get there to get the help you need, that's the highest referral hospital. I went to the highest referral hospital. It was like walking through a war zone. The power was out. There were so many women there that you can't even describe. One doctor saying, you know, one room full of 200 women. You walk to the next room, it's 200 women. There's no medications. I watched a nurse, a woman just came out of OR. She was a lucky woman who is having a C-section because the power was on. And so she'd just been cut open, and I watched the nurse give a prescription to her husband, who's a young man, and he looked like he was in shock, for Advil, basically. So they were saying, go down to the pharmacy, get Advil for your wife for the pain for after the surgery. And he wouldn't have had the money to do that. So here she was without any painkillers, and she was the lucky one. I mean, I could go on and on. I felt like I'd been through a medical ward in D-Day in a war zone. Yeah.
And that's, I think, why we're so committed to making a difference. I was just there in April, and I saw so many horrible stories. We don't even have time to go into them, but that just break your heart. And you think to yourself, you know, in Canada, women used to die regularly in childbirth as well, and people said that's not okay, and we need to change that. We need to fight for moms, and it's different now for moms here. You know, Uganda, one of the countries we work in, has a similar population. 6,000 moms die a year. When us, we only lose about 45, which is still not acceptable, but you know, like the disparity is so huge.
Yeah.
What are we doing to make a difference?
I think what we're doing is what needed to be done in Europe and Canada, you know, 70 years ago, so many years ago. We need to train, so you need trained professionals, and then you need to equip them with the tools they need. So whether it's, you know, a medication that costs 50 cents for a vial that'll stop a mother bleeding out, and the skills and knowledge to make that intervention. So they need to be equipped and trained with the knowledge they need to save the mother's life. And then you need to equip the hospitals with the basics. Part of this as well is giving dignity to mothers in childbirth. In the culture we're working in, there's no dignity given to mothers. And anybody who's been through childbirth knows that you lose all dignity. Just in Canada, you feel like you lose all dignity just in the process of childbirth. Whereas here, they don't have curtains for privacy. They don't have a separate room, you know, to go through the laboring process, and people are walking in and out. So dignity is a big part of humanity. And giving dignity, yeah.
I remember being in a room where a woman was in labor, and there was 17 people standing around her. Some of them were doctors in training, nurses in training, whatever. And the Save the Mothers doctor that was with us said to them, guys, can we just do like 4 people at a time or 5 people at a time? Like, give this mother some dignity, give her some respect. And they were kind of like, you know, it's just culturally, right? It's a learning experience. And I saw the changes that are already being made with mosquito screens on windows, you know, to help fight malaria for moms, and, you know, different new beds. Some of those beds, you've seen them, right? Ripped and dirty and stained. Like, you just really can't describe how bad it is.
And no toilets.
So knowing what we're working on and knowing what we're working toward, do you have hope?
Oh, yes, absolutely. What gets me excited about, we have an enormous ability to have an enormous impact. We just band together, and we can change lives. We can actually make a huge difference for a lot of people. We're talking, you know, the project that we can do can impact 400,000 mothers and babies' lives.
Wow.
That's a lot of lives over a very short period of time, 3 years, 5 years. And every mother that comes in that lives, and that child lives, they have another 5 children at home. So it's not only impacting the life of the mother, but it's, you know, the family's life, husband, all the other children who will now have a mother to come home.
Well, you know, it's such an exciting project. Thank you for the hard work that you put in behind the scenes and continue to do. And I just can't wait to see what we're going to be able to do in the weeks and months ahead.
Thank you.